Midwives are not being valued in South Sudan. They thought like taking care of a mother giving birth is meant to be for women who have delivered because they have the experience. But I really say we make a difference, and why I joined that profession is to save life, to save the life of the mother and the baby. My name is Midwife Scovia Naluma, midwife in Maridi Hospital. I'm married. Currently, he is working in Juba. I have 2 kids. Rojo Faith, she's 1 year and 5 months. And the second baby is called Arach Tracy. She's in Uganda in school. She is 11 years old. Today is Friday. I have an activity to be done with the South Sudan Nurses and Midwifery Association. They're trying to make it so that our profession as midwives and nurses is recognized at the national level. The biggest challenges that we are experiencing in South Sudan, as a midwife, we have very few human resources, and we have a number of health facilities that are not even having midwives, and they are being managed by traditional birth attendants. Traditional birth attendants, they have higher influence to mothers at the community level compared to the midwives. The way they practice, it's not evidence-based. They don't know how to manage complications. So it becomes difficult to give quality service to mothers, most especially in the rural settings. If there were to be roads in South Sudan that can be accessible, where midwives can go up to the villages and talk to the mothers, I think we will not have a big challenge. My neighbors have just come from the workplace, so I'm now preparing for my dinner so that I go for my workplace. I'm making Irish potatoes. I have practiced midwifery for 3 years. This is my 4th year. When I lost my aunt, that was in 2003. She died when she was giving birth. So what gave me interest in midwifery is whenever a mother delivers in my hands and she has no complications and the baby is okay, is alive, now I'm going to the hospital for my night shift. I believe midwifery in South Sudan and in Canada can be similar because the practice, it's not according to South Sudan policy or Canada policy, but it's according to the standards of practice that are put in place to guide everybody to practice in a standard manner. Go ahead. When I come for the night shift, we hand over patients, bed by bed, and we hand over our equipment and some tools that we have in the ward. Safety baby, sepsis. Only what is different in South Sudan is the technology. We don't have any technology in South Sudan. In Canada, they can easily detect and they can take an action. But for us, we use our own eyes to detect. I received 8 patients in total. Currently, we don't have a mother who is in labor, but because of the shift, we normally wait here to get mothers who comes to deliver, and even those ones who are sick, then we admit them. Whether you're a visitor, whether you're a mother or co-patient, and even the midwife has to wear sandals before entering the labor shop. So we are trying as much as possible to prevent infections that are carried from outside using sandals. This is our mother. Since 2 days ago, she has been having false labor, but we are still observing her for tonight. If she goes into labor, also we'll be happy. After delivery, we take what we have done, activities that were done. It's okay, we'll do it. I've had proud moments as a midwife. I remember I got a mother in labor. When I saw the situation the mother was in, I felt like, no, this mother should not go. I have to save her life. I had to donate for her my own blood. So I felt proud because whenever she sees me and the relatives, they tried to say, you have saved my life. Midwives and nurses in South Sudan are not viewed as a positive figure, but I hope with time, if peace continues and people go to school and more midwives are trained and they are taken to all the locations and in the remote areas, with time they will value midwives. In my village, they used to say midwifery is for women. But now I'm seeing even men are turning up, boys are turning up in large number to do midwifery. So I think with time, midwifery in South Sudan will change and will be like any other country.